this is just kind of working on shoulder extension, adduction, and internal rotation, which the combination of those are required to reach behind the back. You want to be very careful with this, especially if you have a lot of shoulder pain, neck pain, back pain, or especially if you've recently had a shoulder surgery. This may not be something you want to start with or get into too quickly in order to protect that area, and definitely want to limit the pain in any way that you're looking at it. Okay, so just want to be aware of those key pieces of mechanics and stability. So stability first. Try to sit into those hips, get a nice neutral, somewhat straight spine with just a subtle S curve. Make sure your head is comfortable and neck. You're not going to shrug, shoulder strain. Keep everything nice and even posturally. Be aware which hip you're going to load. So I'm going to shift to the one closest to you here to give the most support. I could do it here, especially if I'm going to twist. That's possible too, but you're going to feel more stable probably in the same side, at least to start with. So it might be a good starting point. So shoulder, I want to keep that shoulder blade tucked, keep my chest nice and push forward here, those wings forward, these ones pull back, and I can maybe rotate so I get those elements of stability, and then start to get the controlled mobility of thoracic rotation, extension, thoracic rotation. I can turn my head with my body so I'm not craning my neck, or I can keep it there if that's okay. I might get a little stretch here, and that's, as long as it's not painful, that's fine. But I can maybe also see what I'm doing, especially if I have a mirror. So extension is usually the easiest. You might still feel a pull in the front here. Make sure it's not painful, okay? Adduction comes next. So extension, adduction with a straight elbow, easier to control. If we bend the elbow now, we have external or internal rotation. Maybe work that separately first to get some almost like a scooping swimming motion here. Get a little bit of that going. Keep your posture, keep your stability, and then maybe start to add that in with those other two working here. Okay, so once you feel comfortable with all that, maybe add a very small weight for feedback. So if you can control that weight, it'll give you a good sense of how to manage all that. Definitely make you feel that even with 2 pounds. 1 pound might be a better one to start with. You can try maybe a little bit of resistance, maybe stand on the band here on the same side foot, and that way you're pinning it down when you shift your weight onto it. So be careful with that, make sure it's not too painful. Working those muscles, and it is some work. Those aren't, especially in that position, they're not going to be the strongest muscles for you, so be very careful with that. And then lastly, be careful with this if you have any kind of surgery in this area in your spine, or if you feel like it's going to be too much stress on the shoulder itself. You can work on the thoracic. So in this case, I'm actually going to maybe crisscross this. I can use this if I want to just work the thoracic. I can use the opposite arm to kind of do that, but again, make sure you can put weight on that arm. If not, I wouldn't go this route either way. And for this too, maybe don't do the whole arm unless you got a really long strap here, or two linked together, but it's more kind of like coming across like that. So your better bet may be just to lock that in and work here, or put both of them in that hand. That might work too. That one's probably better, as long as you can take it with your shoulder and it's not too difficult. But I'm just kind of guiding, I'm not pulling real hard here, right? Like that, or if I'm thinking about going behind, it would be more thumb down. Again, like that may be too much already for your shoulder, so just kind of maybe lead with the elbow, more that extension, adduction, chicken wing, kind of coming down and in, and shifting here. Flexing a little bit at the hip, rotating from the trunk, and kind of working all those things together without overstressing this. It is a little tricky, but you can always test in the beginning and retest at the end, see how that is. A little rotation, use that to help out and protect your shoulder.